This video will take you through the achievements and impact of the program called Reducing Economic Barriers to Accessing Health Services, REBAHS, funded by the European Union and implemented by a consortium led by International Medical Corps in partnership with Urgence Internationale and Fundación Promocion. The program started in 2018 and ended in May 2022. Its objective was to ensure equitable access to quality health and mental health services across Lebanon by providing free or subsidized primary healthcare services, free healthcare services, and assistive devices for persons with disabilities, free mental health, psychosocial support services, and psychotropic medications. We implemented the program in more than 70 primary healthcare clinics in the past 4 years across Lebanon. The services are available and accessible to all residents in Lebanon. At the end of the first project cycle, REBAHS 1, the number of primary healthcare consultations provided to Syrian refugees and vulnerable Lebanese was 500,000. This number jumped to more than 3.2 million consultations as we finished the project in May 2022. More than 200,000 pregnant women received antenatal consultations. More than 18,000 women received postnatal consultations. More than 188,000 children under 5 received their vaccines. More than 500,000 beneficiaries received diagnostic tests. We completed the essential structure and physical alterations to 70 clinics to render them accessible for persons with disabilities in the past 4 years. More than 2,500 persons with disabilities received physical and functional rehabilitation sessions at the EU-supported clinics. We provided more than 51,000 devices to persons with disabilities. More than 480,000 beneficiaries received acute medications.
Our teams conducted more than 11,000 home care visits in the past 4 years, targeting elderly beneficiaries and patients with limited mobility. More than 9,000 women received a mammography screening for breast cancer, and more than 7,000 women received a pap smear screening for cervical cancer at EU-supported clinics. In the past 4 years, our teams reached more than 84,000 beneficiaries through health education activity. Our teams distributed more than 63,000 NFIs to beneficiaries who attended awareness sessions and participated in other health-related activities. As part of this project, we also work with the primary healthcare centers to ensure they improve their processes and management of the centers. 89% of the primary healthcare centers supported by IMC improved their screening processes for non-communicable diseases, while for PUI, 72% of the primary healthcare centers improved their screening processes. 82% of the primary healthcare centers supported by IMC improved compliance with the selected infection prevention and control procedures, while for PUI centers compliance was at 84%. 83% of the primary healthcare centers supported by IMC improved their complaint system, while for PUI centers, improved complaint system was at 86%. 80% of primary healthcare centers supported by IMC improved medication management and safety procedures, while for PUI, 97% of their centers had their medication management and safety procedures improved. We distributed more than 6,000 medical and non-medical equipment pieces to all EU-supported primary healthcare clinics in the past 4 years. Since the start of the coronavirus pandemic, we have distributed about 5 million pieces of personal protective equipment and infection prevention and control items to primary healthcare centers, hospitals, healthcare workers, beneficiaries, and staff across the country. In the past 4 years, we distributed more than 9.5 million pieces of medical supplies to all European Union-supported primary healthcare clinics.
In the past 4 years, our mental health teams provided more than 126,000 mental health consultations at the EU-supported clinics. Our roving social workers conducted more than 45,000 mental health consultations across Lebanon. As part of the integration of the mental health to the primary healthcare, more than 62,000 beneficiaries were screened by nurses at the EU-supported clinics. More than 430 beneficiaries were referred to doctors who received the Mental Health Gap Action Program training. Our team reached more than 74,000 beneficiaries through mental health education activities and awareness sessions in the past 4 years.